be talking about beauty and motivation. And I'm very, very intrigued to ask MEOR. MEOR,
all right.
What is beauty to you?
What is beauty? Beauty and... No, that's a song. So that's Beauty and the Beast. No, beauty to me personally is something that you have, whether it's external or internal, because a lot of people out there, to my opinion that is, they always look at beauty externally, how a person dress, how their hair is. Granted, I have no hair, but it all depends on those kind of things. But to me, I really do think that beauty does not just portray somebody in regards of their physicality, but as well as how they feel inside, how they think inside. And we will check about whether my statement here is correct or not, and being supported by our guest that we have here today. We have Dr. Koh Ming Zee, the Medical Director of LUMI Clinic, talking to us about beauty and motivation. Good morning, Dr. Koh.
Hi,
how are you?
Good morning. I'm good. I'm great.
Thank you for, because Doctor also just told us off camera that his clinics are closed on Sundays.
Yeah.
So he's available to do this here today. Thank you so much for being here on a Sunday morning, Doctor.
All right.
Thank
so
you.
before we go on, am I correct or not in saying that beauty is not just on the outside, but it's also on the inside as well?
Yes, I definitely agree on what you said just now.
All right.
Okay, so actually our clinic, what our clinic is trying to do is to rebuild the confidence of our client as well. So because we also truly believe that beauty is something not just externally, it has to come from internally as well.
Sure.
You have to feel good about yourself, you have to have your confidence level, a good confidence level to bring out the natural charm.
All right.
Okay, so to me, beauty, you have to have both externally and internally as well.
So you would say, Doctor, beauty actually does in fact affect a person's motivation,
Yes.
or motivation to do anything. Or would you like to elaborate on that? Like, do you think it affects?
100%. Just imagine, I believe a lot of Malaysians, okay, maybe when they are in their teenager age or during their secondary school, they always suffer one problem, which is
Acne.
jerawat, acne.
Ah, okay.
Right.
Speaking from experience there, but yeah, okay.
So,
You're saying you have a very clear face, MEOR.
Go on. Yeah.
Okay.
Go on, doctor, please.
So when they're starting to have, because of the hormonal changes, right, they're starting to have all these acne popping up. And I do notice previously, okay, probably my friends or even my clients right now, they started to lose their confidence level. They become, they don't dare to socialize so much anymore. They tend to stay a bit
by themselves.
Yeah, by themselves. Yeah. So once I have actually helped a couple of patients to get rid of the acne problem completely, and I can see the changes.
All right.
Right. They immediately they regain their confidence level, and then they have become more outgoing as well. So I think so that is very important to me.
Yeah. I mean, there's no doubt in thinking that it gives a person a lot more motivation, a lot more confidence, as you mentioned. Should you have a flawless kind of face, your hair is done well. The problem is that nowadays people are so hooked up with all of these trends and all of these expectations.
Social media.
Social media, actually, I mean, it's really playing such a role in a way that you look at the Koreans right now. You know how flawless their faces are. It's like looking at plastic. I mean, honestly, and the Westerners, how the Westerners are portraying, themselves in Hollywood, in movies. Are these the kind of standards that anyone should be pursuing in, or should they actually look at, all right, I need to be that to be more confident, to have the motivation, to be more accepted in life? What do you think, Doctor?
Okay, I think the most important thing is you have to accept yourself, right? So there's no point keep on trying to become someone else, like become the Korean kind of become like Korean stars, glass skin. Okay, so yes, no doubt we want to keep our outer appearance good, but I do notice a lot of clients when they start to chase this kind of thing. Eventually they will. Okay, there's a syndrome called as overfill syndrome.
Okay.
Okay, meaning there's a lot of you will notice, especially a lot of females, they will started to do some fillers, injecting stuff into their face, and in the end it become overfilled.
Overfilled.
Yeah, so it looks weird. Okay.
All right.
Yeah, it doesn't look natural anymore, and some injected too much of maybe some toxin on the face, making their face become a bit frozen. So you will look a bit plasticky as well. So I don't think that is the thing that we as a doctor want to turn our patients into. Okay, we don't want to turn them into
into mannequins or
yeah.
monsters. Okay, there you go. All right.
But doctor, you did mention, those injectables and all that, and we have in fact seen a number of, I would say, failed cases in getting aesthetic treatments.
Yeah.
I just want to go into that, just straight on. So we've seen infection. There's even in serious cases, there's even cost deaths in some of all of these.
Yeah.
Why does this actually happen? Because there are a lot of people still resort to those kind of aesthetic treatments, and I believe it's not just about certain things. It's also about fixing a certain problem that they perhaps have in their face as well. But maybe a lot of people are fearful because of all these kind of cases. But why does this actually happen, first off, doctor?
Okay, so if you look into those cases, right, a lot of cases happens because they are given some anesthesia, meaning they put the patient to sedation during the procedures. All right, so a lot of time this anesthesia thing shouldn't happen in a clinic in the first place, because you don't have the equipment to actually to perform an emergency. Let's say if anything happens, you don't have the correct equipment to actually save the patient's life.
Sure.
All right. So that's why once the sedation is given, sometimes cases happen when the patient suddenly they couldn't breathe by themselves, and you doesn't have the equipment to save them. All right. So that's when all this situation actually occurs. Okay. So besides that, a lot of people they are because of maybe when they are when they want to do some treatment, the treatment is probably a bit costly in the clinic, so they might started to find some other options, like maybe they're doing in some beauty salon, which is not performed by a
professional medical,
even
doctors,
like unlicensed.
Yes.
Center,
So that's when all the problem can occur, like such as infections, or even by the worst case is death.
Because again, I mean, should you want to look at not just facial features that a lot of people are striving for, those kind of perfection, following the Koreans, you do see a lot of people also getting all of this jabs, all of this, bust enhancements, or even buttocks enhancements, trying to do some slimming things for themselves. It is something that is quite dangerous if it's not done by professionals, but it all boils down to because of the demand and the perception that the public was giving. Hence why somebody would think that, I need to get a bust enhancement, for instance.
It's a need.
Yeah, it's a need because of the pressure of social media, of whatever people are actually saying out there. So, is it really important for somebody to invest in such things, improperly at least, to make themselves feel better in regards of their own life motivation?
Okay, this is a very good question. Okay, so how should I say it?
No, because a lot of people actually go there because, again, people say that, you're too skinny, you need to do something, or you're too overweight, you need to do something.
It is more of a society.
Yeah, it's a society problem then. It's disrupting one's thinking about that. So what advice would you want to see?
Okay. Definitely, social media sometimes influence our perception. Okay, I wouldn't against someone who want to make themselves look better, but definitely not overdoing it.
Not overdoing it.
Yes,
there's always a limit, right?
Yes, there's always a limit. In fact, right now, what we are trying to tell our customer is less is more. Meaning we don't do too much of changes, as in putting in a lot of implants to the body. Yeah, so I think the most important thing is you don't want a life that is just to impress someone else. You want to you want a life that actually you feel good about yourself and you're happy and you're contented. That's the most important thing.
Right. Okay. Okay, doctor. We do get a bit of gist of it. So, but we want to go back to because we're talking about some aesthetic treatments as well.
Yes.
And a lot of people, perhaps, they're not very knowledgeable in terms of. I wouldn't say everybody needs treatment, but maybe some perhaps they do. So we're going to go in and talk about, like, just tell us a bit about aesthetic treatments. What are some of the treatments that people can get, or what is the purpose of technically getting them? Apart from beauty enhancement only, because there are also some kind of aesthetic treatments to be given to patients if they have certain problems with their skin, like we talked about acne, talks about some discoloration, some pigmentation, those kind of stuff. So maybe you can give us a bit of, also tell our audience at home as what type of treatments that people can actually get.
Okay, so I think the commonest skin issues that Malaysian will face is definitely acne. And another one which is also very common amongst the ladies is actually the pigmentation issues, which is what we call as melasma. Okay, all right. So you probably see someone with 2 patches around the cheek area, which is very common. This is something actually related to maybe their hormonal issue as well, and if they doesn't apply sunscreen during their early age. A lot of the UV actually causes this thing to arise. Okay, so in aesthetic side, okay, how can we help in this patient is usually with some aesthetic treatments such as laser treatment or maybe a bit of chemical peeling. All right, that can help to reduce the pigmentation issues. But of course, lifestyle modification also is very important, all right, in order to control it
like
better.
The things you eat,
like the thing you eat, okay, and when you're going out under the sun, you have to make sure you wear your sunscreen, and make sure you top up your sunscreen if you are doing outdoors activities. Yeah, so those are the things that actually also very essential in order to reduce the pigmentation issues.
Okay.
And all this kind of treatments, again, when we want to talk about, correcting whatever it is, like you had mentioned, should you have an acne issue, or a bad case of eczema, for instance, they would kind of like seek professional help just to make sure that they get better. It's not about looking beautiful at the end of the day, it's about getting better. So that should be the main purpose of everyone out there moving forward, isn't it?
Yes, definitely. So, it's not just looking very beautiful or handsome. Some of the patients, they just want to look better because probably they have this psoriasis or some eczema issues that when they are out in the society, they always get how to say, people look.
Yeah, they look differently. How people tend to stare. Okay.
So, MEOR, I want to ask you, did you wear sunscreen today?
I did actually. I did.
So when you wear sunscreen, do you wear it until the back of your...
That's one thing I do want to ask you, because when it comes to beauty treatments, it's not just specifically to ladies, because I do have a lot of men friends out there.
Exactly.
Yeah, because now men, we are that metrosexual. We do sometimes think about wanting to get that extra treatment to be extra shiny for myself. No, I even have friends who actually went on hair transplants because they were losing hair. I mean, that's not wrong, isn't it? For you to just want to be better, isn't it?
Yes.
When it comes to these kind of treatments, they just want to feel better, and the byproduct of it is being more beautiful. I'm putting myself out there. Okay.
So, I mean, that's because it's into men's grooming as well. Previously, men's grooming, actually, I think beauty is very much related to women.
Correct.
I just want to add on to MEOR's statement. Beauty is very much related to women. Even you, doctor, you mentioned some of the treatments that women usually get.
Yes.
But I'm pretty sure there are also men who come to you with certain problems in terms of not just skin problems, but perhaps they would want to get some beauty enhancements as well. How do we, break the stigma that beauty is only for women here? Because we want people to know that beauty is also MEOR.
Okay,
Okay.
Doctor, please.
Okay. So, yeah, I think nowadays, not only women want to look good, I think a lot of men also, they want to look good as well. Okay, you just imagine, let's say if you are going out, let's say you're going out with someone, with your partner, okay? Perhaps your partners. If your partners has a lot of acne on the face and their face appear to be very oily, you don't feel good as well, right?
All right.
So you feel,
as a partner, you won't feel good.
Yeah. You feel a bit embarrassed, right? Yeah.
Right.
So actually, it's not just a women things. I think for men nowadays, you will need to look, not to say very handsome or very beautiful, okay, but at least you need to look presentable, clean.
Yeah.
Okay. So yeah, I think that's
All right.
But doctor, we're talking about looking presentable, looking clean. I do want to ask because another trend that is going on is, of course, it's about skincare routine and all that relating to skincare.
Yes.
Do you think skincare alone, apart from aesthetic treatments, is actually enough to treat skin conditions or any problems with skin?
Okay, so skincare alone is actually essential to maintain your current conditions. Okay, but let's say if you are looking for some enhancement, probably skincare alone is not enough. Yeah, so you might need to consider some treatment, especially let's say if you are having some wrinkles issues, or maybe if you're having some face sagging issues, skincare alone couldn't really help in tackling those problems.
Yeah. You kind of need to dive in a bit more and really understanding what it is all about. All right, awesome stuff. Together with our guest here, we have Dr. Koh Ming Zi, the Medical Director of LUMI Clinic. Thank you so much for sharing your expertise and talking about beauty and motivation. I don't know why I went there, but yeah, thank you so much, Doc, for your time. Appreciate it.
Can I add one more?
Yeah, just quick one.
Yes, of course.
Right, so whenever you're doing for all this beauty kind of stuff, aesthetic kind of stuff, I want all of you to remember one thing is you need to find a licensed practitioner to do it for you. And the license, please look for what we call as LCP license.
LCP.
Yes, that is actually the license which is approved by the KKM. All right, for the doctors to perform this. Not every doctors can perform aesthetic procedures. The doctors who has the LCP license can only perform.
LCP. Even I didn't know about that, doctor. So thank you so much for highlighting that to us as well.